Our best patients are the patients that want to be educated. Believe it or not, if I have a patient come in and say, I heard you were great, Dr. Salama, you come very well recommended, and I trust you. And the first thing I would say to them is, I really appreciate that, and I thank you for the trust, but I still need to educate you. Because an educated patient is the best patient I can have. So my goal, and the reason I loved when you came to me and asked me to do it, and you did research on me and I did some research on you, I wanted to see what you were really looking at, what you were thinking about doing, and the process of educating patients was very critical to me, and it was obvious that's what your intent was. Mm-hmm. So for me, what I would tell patients who are considering this kind of care, this is very important. Unlike our medical doctors who are subspecialized, even in dentistry, a general practitioner can do any type of dentistry. They can do oral surgery, they can do periodontics, they can do endodontics, they can do orthodontics. They're not limited. They can do anything they want. Yeah. The difference between a specialist and a non-specialist is the fact that you have extended training in the particular discipline. Now, they can get this out of school. All-On-Xpert is one way of doing that. We offer programs to try to assist people in getting some of their education outside of a classic graduate program. But the fact is that they're not specialized right out of school. This takes experience and it takes education to do it. And it takes certain factors. Diagnosis is key. You need to have a CAT scan machine. They need to understand how to treatment plan in 3D. So we have software that we use that takes the information about your jaw and allows us to actually do the surgery on a computer screen before we actually do it in the mouth. And I can show the patients that in different colors, in 3D, in their mouth. Think of it taking a test drive or a flight simulator. You wouldn't get in a plane with a person who never flew the plane for a couple hundred hours on a flight simulator before you got up in the air, right? So why do that with All-On-X? Even if you go to somebody who's not a specialist, they need to have had the training. But I would ask the question, where did you get your training? If a surgeon, will say that they went to 4 years, 3 years, whatever programs that they were in, they have training in oral surgery, in periodontics, in implantology. General dentists may have had training at an academy, may have had training with CE courses, that they were trained in this discipline, because this discipline requires multifaceted training. You need to know the parts, you need to know the anatomy, you need to know how to do the procedures, you need to know the surgery, you need to know the restorative dental part, actually how to make the part that connects the implants to the teeth that eventually go in your mouth, and then the laboratory part. And all this with digital technology. There's digital dentistry now where we are fabricating your teeth utilizing 3D printers and 3D milling units.
So cool.
So the materials, zirconia, monolithic zirconia, these materials, they are only been around for a decade or so. They haven't been around for 50 years. So people have to be involved in understanding the materials, educating themselves.
On an ongoing basis.
On an ongoing basis.